Hi, and welcome everyone. My name is Anthony Torres, and I will be your moderator for tonight. We are now at the talkback portion of tonight's event. I would like to introduce you to our panelists. And give me a second. First, I'd like to introduce you to Colin I'm sorry if I mispronounced this, Askey. Colin's a filmmaker who has spent the last decade documenting the transformative impact of human policies on the lives of people who use drugs. Recently, works include Haven 2019, an award-winning short film documentary about North America's first prescription heroin therapy program in Vancouver, and his current film, Love in Time of Fentanyl, which premiered in 2022. Doxa's documentary film festival, where it won Colin Lowe Award for the Best Canadian Director. Next, I would like to introduce Rayce, who is the frontline of the overdose. Sorry, I'm just stumbling all over my words here. He's the overdose epidemic. Since the graduating Lewis and Clark College in 2020, he has dedicated his time to pursuing harm reduction and direct human services. He is currently the supervisor of the first sanctioned overdose prevention center in the United States at ON POINT, New York City. Next, I would like to introduce Dinah Ortiz, Urban Survivors Union. Dinah dedicates most of her time advocating to the end of stigma faced by drug users. For over 10 years, she has advocated for marginalized parents in a variety of contexts. She has appeared on dozen of panels nationwide to discuss the racial disparity of children's welfare systems, as well as educate doctors, lawyers, social workers, harm reduction methods to better serve and save lives. I just need to correct, it's not Urban Survivors Union, is National Survivors Unions. I apologize, Dinah, we went over that. Next, I want to introduce Stacey Ross from 21 Mercer County. She is the executive director of Recovery Advocates of America, and is also a certified recovery coach, as well as a certified peer recovery specialist. She plays a vital role as a mentor to many women in her community with multiple years in recovery. She does anything necessary to maintain the long-term sobriety. Thank you everyone here for being for this important conversation. I guess I want to start out with you, Colin. What was your thinking and what is your hopes when you were creating this film, this documentary?
Thanks, Anthony, and thanks everyone for joining us. Yeah, my hope for this film was, I guess really I didn't know at first. I was a part of this community for many years. I worked in harm reduction in this community, including at the first safe injection site in North America at Insight. And this was really my kind of introduction to harm reduction when I started working down there. And I come from an abstinence-based kind of recovery background. I was court-ordered into a treatment center when I was a teenager, and also went on to work in that treatment center for many years. And when I started working in harm reduction, it really kind of went against a lot of those ideas and really everything I thought I understood about this issue, and really opened, I guess, my mind to this issue and different ways and different needs that people weren't receiving, and how I guess the accessibility to treatments meant different things and for different people, and also just the benefits of really being able to meet people where they're at, welcome people that aren't really welcome anywhere else in society into a place, and really see firsthand how those relationships that were built really benefited people in numerous different ways. And while working there, I just kind of really learned to be a part of that community. Was also a filmmaker, so people were starting to ask me to do different films to raise awareness about certain issues, as well as apologize for my cats in the background here that are on cue, running around every time I seem to be on a panel. Yeah, I guess like over the years, I just, the downtown east side on the surface, I think a lot of people have a lot of strong opinions about, and it's often viewed as like a problem area. It's known as Canada's poorest postal code. But underneath the surface, it's filled with amazing human beings, and the best way to describe it is kind of being surrounded by thousands of stories of tragedy and trauma, but also resilience and courage. And it's a community of people that really have been rejected from other places in society and found a place not only to get services, but also to feel welcome and really take care of each other there. And through kind of my filmmaking and being asked to do different projects, I really got to hear these stories, and it was a real privilege to be able to learn more about all the different individuals in the community, but also the history of the grassroots activism that created a lot of these services, and a lot of them built by people who use drugs themselves. Vancouver Area Network of Drug Users was one of the first organizations of drug users to organize and demand the services in their community for themselves. So the community just, I guess, really means a lot to me, and is a place that I still feel, as part of my community. And I moved to New York in 2016 when fentanyl hit Vancouver and really took over the drug supply. And there was a point there where almost weekly we were hearing about friends and loved ones passing away, and knowing the friends that worked down there, what they were going through. And I really wanted to kind of capture the response, which was led by the community. I think a lot of the media at the time was focusing how difficult it was on the paramedics and such. And it was, I know this crisis is really hard on everyone, I think, but no one was really covering the response from the community, which was really leading the charge and teaching themselves how to use naloxone. And they were the ones that were usually the first responders before paramedics got there, that were reversing the overdoses of their friends and loved ones. And so what I also like, the reason why I think ops, there was numerous responses going on in the community, and why ops felt like the right choice for me is that I've known like Sarah and Ronnie and Norma for years, and they knew me, and that was huge, because obviously I needed that trust, and they needed to know that I wasn't going to tell the usual story that media does and have the usual kind of come there with my preconceived notions and exploit people, and also knew how to not be in the way of services. These are life-saving services, and I didn't want anyone to be able to go in there and not feel comfortable because there was a camera around. So I knew that they knew that I would respect the people there and the place, and so it felt like there was an opportunity there to really tell this story. And I guess like the thing I wanted people to get out is just that I think we as a society have a lot of deeply entrenched beliefs about this issue and about people who use drugs, and these were what I wanted to show, give people a window into something they maybe hadn't seen before, and also just to hopefully look at this issue and these people in a different way.
Thank you. And I just want to say how you really show a really accurate representation of people living in such a way, and how the beauty that often people don't see, and the love that's between that community, and how you bring it home. That's really a difficult thing to do, and you really do that well in this film. And I just wanted to say thank you for that.
Yeah, I'll just add that, like, having the experience of working in a site and also knowing the magic that happens inside there was something that was important to me, and that I think a lot of people have opinions about these places, that it's just places where people go and use drugs and that's it, but there's so much more to it, and really that's what it's about, is the community that's built inside these places for people that don't have a lot of supports, and that is huge, and that's where what I wanted to focus on, because there was so much tragedy and death in this community outside of these places, but inside these places it's really about life, and they're full of life and laughter and love.
Yeah, absolutely. So the next question I kind of want to bring over to Dinah. At what point do you think that people are stopping seen as individuals who are using and become seen as addicts or active chaotic users, like in society as large? Absolutely.
Yeah, and so
So the next question I
thank you
kind
for
of
that
want to
question.
bring over to
I
Dinah.
would say that
At what
due to the
point do
drug
you think that
hierarchy,
people are stop being seen
you don't
as
ever hear people
individuals
that smoke marijuana being
who,
called
are
addicts,
using
or
and
the way
become
that we
seen
say it
as
in
addicts
National
or
Survivors Union, in chaotic
society
use
as
or
a whole.
dependent. But whenever they are using anything considered hard drugs, such as heroin or crack cocaine, then they are considered addicts. That smoke marijuana being called addicts, or the way that we say it in National Survivors Union, in chaotic use or dependent. I'm sorry, I'm getting double talk, so I can clearly hear the original. Can you repeat your question?
I said there's a bit of a feedback. I'm not sure where it's coming from.
Yeah, that's what I'm getting also. Let me get some earphones, hold on.
So while you're sorting that out, I'm gonna. There's a question for you, Stacey, from the audience, and here is, I'm interested to hear your perspective based on your experience and based on the I guess godly work you do every day. Do you agree that the way you deal with this situation is to enable people to safely use drugs, or instead to work hard to wean them away from the drugs while treating them with respect?
I think that's a great question. Thank you for having me on here. And I have to tell you, I was pretty closed-minded before watching the documentary. I am in an abstinence-based program. I do help a lot of people, but I do agree with Colin. We have to meet people where we're at today. Things are changed completely different with fentanyl and with the tranq that is in the dope as well. You know, not one size does not fit all. For me, abstinence-based works. But I can't force my views on everyone else because I'm not I am out in the community. When I am in a 12-step based program, I accept all. I meet people where they're at because I don't want to scare another person away from getting into recovery, some form of recovery. I had to stop with the old thinking and bring in the new thinking because we're getting a new generation of people coming in. People are coming into recovery very early. From 18, I deal with girls that are 18, 19, 20 years old. And, we're losing so many people. So, I know there's a lot of people that probably don't agree with that. We're all entitled to our opinions. Everybody has opinions, but I do. It really changed my view. I think we need to start thinking in a different direction because I am tired of going to so many funerals. I'm tired of hugging the family members of people that are lost. I just lost 2 people this week. It's not getting better. And I think with broadening our views on what these places do, because people do feel like they are forgotten about. The people that I deal with now, out on the streets in Trenton, once they're in encampments and they're homeless and they're addicted, to the substances and women, the things we do. I mean, we have to look at safe places where these people can come to and they can feel like they're a part of society, because that is part of the problem. So it's part of it. There's so many things that need to be changed. But it did definitely change my perspective. And I keep myself open-minded and right-sized and try to meet people where they're at and try to see different views and not, go against them. So hope I answered your question.
I would love to hop in here too and kind of talk about, my experience working in an overdose prevention center in New York now, and kind of what you were talking about, Stacey, that connection in that community. I mean, that really, and that's what came through in the movie. That's one of the most impactful things I see every day working in the overdose prevention center. And I could say pretty guaranteed that every person who comes in that room has been to detox, has been to treatment, right? Has tried one of these programs before, and it's not going to work until that person is ready to do so. So success on one day might be, giving somebody a shower, letting them take a nap, giving them a cup of coffee. And on another day, it might be making that call to detox and getting people, to make that next step. And we do that too. So I think really it's that connection and that communication and that relationship building between, you know, recovery and harm reduction. That there shouldn't be this big barrier between the two, right? It's working hand in hand. What works for one person might not work for the other, but if it works for one person, that's awesome. And let's applaud that.
I just wanted to add one more thing that was beautiful the way you put that, because when we get we see the people at that level when they are on the streets, the trust is broken. You know, and bridging the gap and building the trust. I see it all the time. I'm not ready, and I respect that. If you're not ready, we cannot force anybody into recovery. But what we can do is build that trust and build the relationship with them. And I see people go from totally not wanting to do anything to actually, you know, getting people right out of the, you know, being homeless and in the encampments, and getting them into to get help. Detox and treatment, I'm a supporter in that, but I've been in over a dozen. It doesn't always work. It's when you are ready to surrender and truly stop using is when it works. But I totally agree with everything you said, Rayce.
I'd like to also kind of jump in on this. Can everybody hear me okay now? Good. Yeah, so, and also adding that on top of what Rayce said and Stacey, that recovery looks different for everyone, right? And it means something different for everyone. The end goal is not always abstinence, right? It is being able to live a good, healthy life and function and be a productive member of society, right? And not hurt or harm yourself or anyone else. And so when we start kind of like realizing that abstinence is not the only goal and the end goal, right? And the best goal, that's when we can start accepting the community of drug users for actual human beings and not those people, addicts, you know, drug addicted, all of those stigmatizing terms that even drug users think about.
Okay, can I build off of that last discussion? So coming from here in New Jersey, we have a huge abstinence-based kind of thinking and culture here. Now we're moving with this conversation into harm reduction and where abstinence may not be the goal. I think stigma plays in all of this in terms of recovery when necessarily abstinence is not. How do you think stigma plays out in that? To you, Diane.
How does stigma play in to kind of like the harm reduction area, you mean?
Yeah, I mean, it's like, so we come from a culture where, you know, abstinence, you cannot use, you cannot think, and if not, you're bad. You're doing something, you know, you're not doing what's right. And now we're changing it to harm reduction. So someone's using, so how do you help people navigate that?
So it's about understanding that everyone is human, right? And we all make mistakes. The difference between the stigma being added is either you are homeless or you are not, right? Either you are poor or you are not. Either you are marginalized or you are not. That is where the stigma comes in, because you have affluent folks who live and use in their homes, and they share with their friends and they talk about it, they blog about it. There's no stigma attached. Oh, these other pop moms, oh, look at them raising their children. There's no stigma. But when you go down to the hood, right, and you see brown and Black folks and they are using, and you know that they use, then it's, let's call ACS, their children must be neglected. Let's call the cops, they must be doing something bad in their house. That is where the stigma is attached. Harm reduction has always been around. Drug users have always utilized harm reduction methods, even if we have not known it, right? It is about embracing that causing less harm and using less and just being healthy, making sure that you are just staying healthy. Harm reduction is going to your doctor's appointments. Harm reduction is making sure that your home is clean and that, you know, that your kids are taken care of. Harm reduction is taking care of yourself. Harm reduction is reproductive justice. Harm reduction is all encompassing. It is not just about drug use. And so, you know, you think about causing less harm, taking care of yourself, taking care of your loved ones, and making sure that, you know, nobody is being affected by your drug use, right? You can still work, you can still go to school, you can still do whatever it is that you have to do in life and use and be effective.
I think a really, to hop in here, a really kind of dangerous thing that stigma does now with the fentanyl crisis happening, with stigma and drug use, it pushes drug use into the shadows, right? And it pushes people to use and to be ashamed of the use and to not tell people about their use. And so with this fentanyl crisis, right, the risk of overdose is just so much higher. So what somebody might have been able to do for decades before, even now doing it alone, and that shame, and that's where it really is dangerous. And so even using other drugs, not opiates, I'm sorry. So for example, a line of cocaine that you might use alone in your room that now might be poisoned with fentanyl, right? And so I think that's where the danger of the stigma that I see every day with this compounding with the fentanyl crisis is putting people into further harmful situations when they're using, right? Yeah.
And just to add on to that, Rayce, you know, something that I heard the other day, which is absolutely obvious, is that people say, oh, well, you know, just use alcohol instead. You know, alcohol is not safer, it's just legal, right? That is the difference. As soon as we legalize drugs and we decriminalize them, they become safer.
I think it's also, just to add on too, is like it's important, I think, for us as a society to just like look at where this stigma is coming from and the history of how we've handled, you know, this issue and people who use drugs. There's a long history of misinformation, you know, and to say the least, you know, including like racism and using drugs as a way to target, you know, certain groups and stuff. And I think the more people can educate themselves around that history and around this misinformation, it is really, you know, I think that plays a large part in what has deeply, you know, entrenched those beliefs in us. So then when we're faced with now over 100,000 deaths a year, I think it's pretty hard to, you know, to rationalize that what we've been doing is working. And the problem is that us as a society now faced with this still have this stigma towards, you know, opening our minds to different ways of looking at this issue, and we stigmatize harm reduction as enabling, or these sites as just, you know, encouraging drug use, and we have all these thoughts that come from this that really aren't based in evidence. And I think like it's the way to really, you know, truly destroy stigma is just honesty, I think, and truth. And the more people can educate themselves about the realities and about even drug use, you know, we're so scared to actually tell people about the reality of drug use because we think we're encouraging it. And that's just really making things, as Rayce was saying, so much more dangerous for people. Because the reality is, you know, we've been trying to just say no and criminalize and punish this for many years, and things have just steadily gotten worse and at an epic scale, you know. And as it's been said, I think that we're sick of just seeing people dying, and it's time to try something new and try to look at new ways of thinking about this and accepting the realities, you know. Yeah. I think you're muted, Anthony.
Sorry, I have this laptop that fell. Apologies. So one question from the audience is a comment, let's say, is that in rural areas, e.g. South Jersey, people may not have access to treatment and the harm reduction may be their only option. So that's to bring that up as well. I just want to tell the audience also, if you have any questions, please put them into the chat so that way you can see them and ask our guest these questions. So moving on, for Rayce, we were talking earlier about offline, we were talking about the money, and when people normally get services here, especially in New Jersey, it is your last zip code that you live at will tell the people where they can get services. And understanding, especially chaotic users, they may travel here and there. How does your program fund people, allow them to have access to that? And how do you think in the future the funding to go to people that are using your services?
Yeah, so our program is a low threshold program. So we try to have the least amount of barriers to get in. So anybody can walk in our door, do a quick intake and an enrollment with us, and within 10 minutes be using our services. So we're not limiting anybody to use our services based on anything at all. But that means I see people coming from all over the place. You know, we're located in East Harlem and Washington Heights. So people are coming from Jersey often. I live in Brooklyn. So I'm traveling an hour every day, twice a day to get to the site, to go work in the site. Every day people are telling me they're traveling an hour and a half, 2 hours, you know, far away to come use the site just because they want to do a shot and not have to be scared they're going to die, right? And it's a pretty basic human dignity there, right? So I think the future I see is just expanding these sites everywhere, right? Expanding these sites within our communities. A big pushback that we've seen of our site in Harlem is that there's a disproportionate amount of drug clinics and methadone clinics in an area that's mostly housing Black and brown people. And I understand that. And we're saying we should open these in all communities, right? We don't want these sites to be located far away for people to travel to, right? So we want to really democratize that. Just going off the funding issue, though, that's where we're really struggling. You know, my program, the Overdose Prevention Center, we can't use any federal grant funding, state funding, opioid settlement funds. We're completely funded by private funding and donation funding. So we're really struggling to stay open. We've been open over a year now, but we're really, you know, on a month-by-month basis, relying on angel investors to keep donating us money. And we're going to Albany, we're going to fight, proving that we think we should be using money that's allocated to help the opioid epidemic to use our programs. So I think just having conversations like this and documentaries like this, expanding the conversation, our organization has been very transparent. If you have questions about it, if you're confused about the site, our doors are open. Schedule a visit, come on in, right? We're very transparent. We want people to come and see what we do. Down the street from our site, there's actually a school located down the street. When we first opened, there was a lot of pushback, right? There's a school near our site. And just over in Thanksgiving, they donated us over 50 pies to our participants, right? So we built this relationship with our community in our block, right? We're inviting people in to show them what we're doing as a human thing. Yeah.
Awesome. Thank you.
Just to add onto what Rayce was saying, just for some other numbers there, that in the first year they reversed over 600 overdoses, and the estimated cost savings for that is over $20 million. And so just to consider all that the ambulances and police and fire that have to attend an overdose, you know, if maybe this issue hasn't touched you personally, it's another way to think about this, is how much taxpayers' money you can save just by having these sites. Not only does it, you know, is there less people using drugs in public? Is there less syringe litter in public? And most importantly, numerous lives are being saved, but it's also saving taxpayers' money.
And also, to add on to that is that is what harm reduction looks like, right? People traveling an hour and a half with the drugs on them, right, to go use them safely. So all of that, all of these ideas about how drug users are irresponsible and how drug users they all they do is, you know, they want to use in the street and they want to like ruin people's lives. That is what that is the epitome of harm reduction. Drug users saying, I want to live today, so I'm going to use my drugs safely in this safe injection site. That's amazing.
Absolutely. So I'm going to go back to the question that I gave to you earlier, Dinah, and kind of like rope it into an audience question here. So what I had asked you earlier, at what point do you think people stop being seen as individuals and become seen as addicts in the community? And I think the person in the audience that asked something very similar, where during the crack epidemic, which was largely about Black and brown people, drug users were demonized and put into jail. Do you think that the drug problem now is seen as more of a mental health treatment problem because it's more people who are affected?
Oh yeah. When white people started dying, the game changed.
Yeah.
You know, and I can't say no offense, because if you know, you already, you know, the crack epidemic was about Black and brown folks. You saw, you know, the jail terms, the prison terms raised between powder and rock. Insanity. Black and brown folks have been dying for centuries, right? But it wasn't until it became the gentler drug war, you know, the white people, the rich people dying. The fact of the matter is that you don't know who uses drugs. You don't know. Your colleagues use drugs. Judges use drugs. District attorneys use drugs. A judge in North Carolina died of a fentanyl overdose a couple of years back, right? If he would have lived, if he would have not been ashamed to come forward and say that he used drugs. So we need to stop brutalizing and stigmatizing communities who use drugs, because everyone uses something, right? Everyone is dependent to something, maybe drugs, maybe sex, maybe nicotine, maybe alcohol. You don't know. And you can sit there and talk about people who use drugs all day long, and the person next to you who uses drugs will die eventually because they are so ashamed of the fact that they use drugs. There is this hierarchy in drug use itself, where it is marijuana, you are cool, you are, you're fine, you're not even a drug user. But when it comes down to crack cocaine, if it's powder cocaine, you're rich, right? You got money, you cool, it's social. Crack cocaine, you're an addict. Heroin, you're an addict. Fentanyl, you're an addict. Methamphetamine, you're an addict. There is a hierarchy in drug use. I cannot say that even drug users are not biased. We are biased, right? I say to myself, I represent pregnant and parenting folks who use drugs. And I always ask myself, what is the first thing that comes to mind when I see a pregnant or parenting woman or folk who uses drugs? I'm like, they don't care about their kids. And I was her, right? That was me. And my kids are my life. My kids are my life, and I would die for them. So I have to check myself on a daily basis about my own biases when it comes down to drug use. And, everyone is not dependent. Everyone is not in chaotic use. So, and that those words are to kind of, just when you say addict, dependent or chaotic use is equivalent, just a non-stigmatizing way of saying it. And I just say that if we start just understanding and educating ourselves, stop listening to the junk science. One of the things out there is that, pregnant and parenting, when folks who use drugs, are killing their babies, their fetuses. That's not true. Nicotine kills more fetuses than any drugs. So we need to really educate ourselves on actual science-based fact and not junk science.
Thank you. I have a question I want to kind of throw out to all of you. And this is really more for me than anyone else. What do you think are the barriers that you see to implementing harm reduction as you were implementing harm reductions in your own life, in your own communities? What do you think were the biggest barriers that you had to deal with, or anyone that wants to start something like that? What are the things that they need to be prepared to face to start a harm reduction program? I'll start with Stacey.
Thank you. I just always think from what I do, like I voluntarily run sober homes for women. So I even look at stigma with that. Not in my neighborhood, not over here. Everybody wants it. We need it, how Rayce was saying, we need it accessible to everybody in every community. And I think breaking the barrier of that stigma that, we are all criminals and horrible people, and, we're going to rob you and rape your children, all these horrible things. And I hear this in town meetings, that people think these things because that these people were using drugs at once. And they're I think breaking down the barriers of changing people's minds to because what we were doing isn't working, and we're losing so many beautiful souls. And these are not people that that the typical people that you think. I mean, these kids are from really good families. It doesn't matter, rich, poor, black, brown, white, it does not matter. This disease does not discriminate, and it is killing way too many of us. So I just think that the discussions need to happen, and we need to get people involved in really just educating themselves on, like Colin was saying, taxpayer money. I mean, it will be saving taxpayers tons of money, and that's what everybody cares about. Most people that have opinions on this is the taxes and what's going to raise them and what's going to lower them. And I just think we really need to educate ourselves and the community around us and be more open.
Does anyone want to add to that, Rayce?
Yeah, I mean, kind of to answer the question about like opening a harm reduction program, I think what the heart of a harm reduction program is, and this was what was so beautifully highlighted in the film, it's highlighting the voices and of the people who use drugs and people who have lived experience and people in the community, right? And like at its core, that's what harm reduction is. People have been doing this for a really long time. People have been fighting for this for a really long time. I'm very privileged to come in now and be part of this amazing, you know, groundbreaking work. And I'm very understanding of the hard work people put in for long before I was born, right? And so just continuing to highlight the voices of the communities. And then also, you know, one of the things that struck me the most in the film, and it's kind of hard for me to watch, is everybody talk about burnout. This is tough work. It is really tough work, harm reduction. It is really tough work working with people and showing love every day, you know, and losing the people that we work with, and both participants and staff, you know, it's going to continue. It's not going to end. So, but again, that's why I continue to do it, is the people itself, right? Is the people in that community, is why it's so amazing. You know, it's a great, I think that's what one of my favorite parts of the film is, everybody laughing and dancing. And, you know, I think about the dance party I had today in my room, right? And so I think it's all the joy and the laughter and the love that happens within the community.
I can just add on to what Rayce is saying about that. And I think that it's the sad thing I've seen in these communities and in this work in general for many years, is it's amazing people fighting for their community or for these services and doing this work. And I think maybe as you saw in the film, it's super tough work, and it's difficult, and I think it's hard on people, and that's hard enough, let alone to have to deal with the lack of support from society and government and funding and constant. And I think that is what breaks my heart, is that and part of the reason, you know, often this work is in the shadows, and this is kind of like a very unique window, because I think people that do this sort of work are so used to the controversy that they just kind of do it in the shadows and don't, you know, ask for any recognition or anything like this. And my hope is that this film shows that there's some amazing people doing incredible stuff for people and saving lives on a daily basis. And not only are they doing that, but they're facing little, you know, they have little support from the rest of us. So I think my hope is that people will educate themselves, you know, look at the evidence that's out there about these services. It's not opposed to treatment. It's not enabling, you know, it's giving people a chance, you know. And a thing I heard early on from many folks, which is tough to argue with, is that people can't detox. If that's our idea of what is healthy for someone, and that what people need is abstinence, then you know, and everyone said it tonight, usually that doesn't happen the first time around, and we need to keep people alive long enough until that's an option for people. But I think what the film about isn't about getting to people that, it's about looking at the community that is a beautiful community, whether they're using drugs or not. There are incredible people that are doing incredible things and need more support, and need more of us to be aware of what's happening and the realities of this crisis.
Yeah, and I'd also like to add that, like, we really need to think, if we're talking about drug use as a health issue, right? Then we need to think about it actually as a health issue. And we don't tell diabetics that they need to stop using insulin after a certain amount of time, right? We don't tell people with cancer that they need to stop using their pain management pills, right, after a certain amount of time, or medication after a certain amount of time. The only people that we dictate that they need to be abstinent to are drug users, but we call it a health issue. So we need to really, really have an honest conversation about what it looks like for us to call drug use a health issue, and the difference between chaotic use, active use, abstinence, recovery. All of these things need to be talked about honestly. And we need to, if we want to include drug users at the table, right? We need to start thinking maybe they should build the table and invite us to the table, because they're the ones with the lived experience. They're the ones that have the answers. And so give drug using communities money, funding to be able to build these tables. That's why we haven't built them, right? That's why we're always trying to submit proposals to go to other people's tables, because we don't get the funding because we're drug users. So yeah, we talk about helping drug users, but do we really want to help them? Because we only talk about it until they're there. So we really need to have an honest conversation about this.
Absolutely. I have a question from the audience, and let me just get it up without knocking my camera over again. So bear with me a second. As we become more sensitive to diseases, would we take the same approach mindset with regards to sex offenders or pornography addicts, for example? Should we be understanding of that behavior, enable them to do it safely when it comes to being an addict? At addictive behavior, where it's appropriate to draw the line. Where is the line drawn? Who would like to take that on?
I mean, I don't know how to respond to that kindly, other than like, you know, each, I think that this is like the stigma that we're talking about, is that this idea of lumping a group of people who use drugs into and relating to different issues is really, I think, a completely unhelpful question. We're in a crisis where 100,000 people a year are dying, and we're choosing to look at something like a service that saves lives as that offensive. Then I think we got a real issue, and I think that's a good example of what holds us back from helping people. Yeah, if that's people's viewpoints and stuff like that, and I think I would encourage people to just educate and look at the numerous amounts of peer-reviewed research and evidence that's available about, you know, look at the evidence we have now of how that's working, and then look at the numerous other, like, we're just talking about overdose prevention sites right now, but harm reduction is and services that actually work. There's a lot more to it, and there's a lot that are completely stigmatized and unavailable in this country that are actually working in other places. So, I mean, I don't know, someone else should help me out here.
I mean, I think with personally with that question, I think they're equating addiction as a whole as when with treating it, how would harm reduction look in other avenues? I don't think it's I don't think the person asking that question understands. We're talking about people's health here, and then this is talking about consent and something which is kind of a separate thing when it talks about and which it's not although addictions used for both of these populations, they're not equivalent, I think is what we want to say. Is Dinah, come on, tell us.
Yeah, I just can't, you know, sometimes I just can't, right? So here's what I say. Please educate. Like Colin has said. If you want to know, like, this information is available online, right? If you want to know, attend, you know, a drug users meeting, a drug users union meeting. Ours are on Tuesdays at 9 o'clock. I can send out the link. Like, just hear the community's voices and hear about, you know, the conversations that we have. Harm reduction is all over these meetings, right? Like, we are having doctors on to talk about, you know, the pandemic. We are having you know, all kinds of experts on to educate us budget-wise, like all of these things. Like, we are human beings, right? Forget about abstinence. Take that out of your mind. We are human beings who are functioning every day with a million other problems to worry about than thinking about, today I'm going to stop using drugs. Today I'm going to worry about what food I'm going to put on my table. Today I'm going to worry about how I'm going to get to work. We do all of these things that you do. We just do them with the added pleasure of using drugs. So, you know, rethink how you see drug users, rethink how you have that conversation, and forget about abstinence for now. If that is your thing and that is the goal that you want for yourself, then that's fine. allow people the bodily autonomy to do what they want and to put whatever they want in their bodies, because it is not hurting me.
I just want to add that, like, for me, it's like looking at what we value as well, and it's like a lot of stigma stems from like fear and of things we don't understand necessarily. So I think, and sadly, a lot of that comes from like people's, you know, ideals of what's right and wrong and all these things. And I will say just that, you know, when we watch the movie, I think that both Norma and Dana are probably some of the kindest, most compassionate, amazing human beings that I've ever had the honor of you know, knowing. And they're people who use drugs. And I think that, as we see in the movie, they're saving lives every day. They're making, you know, meals for their community. They're doing more for their communities than I think most of us are. So I think like we have to take a look at, you know, what we value and I don't know. Just wanted to throw that in there.
Yeah, I think that's important that you, you say that. Does anyone want to add into this part of the conversation? Okay, moving on. So here's another question for all panelists. What is the one thing you most want people to know about, like awareness and recovery, that you don't always get to share? Bueller?
That if we don't legalize and decriminalize drugs, people are going to continue to die. Point blank, period.
Yeah. How about you, Stacey? What are your thoughts? What is it, the one thing that you always want to tell people you don't get to come out and share with people?
Well, I'm very open, as you can see, with I talk about, I speak my mind. But I agree with Dinah, what she's saying, and we just need, you know, it's a disease. Like we are some of the kindest, most giving people on this earth. I mean, the people that I meet that are actively using or in some form of recovery, we are not these pariahs. Like we're not these horrible people that are out there. You know, they're some of the kindest people. Like just, you know, especially when you see homeless people, like talk to them. Like they're not invisible. Like I could almost get choked up crying because they are my people. They are some of the most beautiful people I've ever met in my life. And all they want to do is see that you see them, you know, see them, talk to them, see what they're going through, you know. That's all.
Does anyone have anything else to add? Because we're just about ready to wrap it up.
I think just real quick to piggyback on that, I think often when I tell people like what I do, I get asked that question right there a lot. And I think one of the biggest misconceptions that, again, like the film really comes to light is in these spaces, like the least interesting thing that's happening is the using of drugs. That's happening. It's safely happening, but that's the least interesting thing. You know, I could say I've saved hundreds of lives. I've set tons of people to detox, and by far the most powerful thing I've ever done, the most powerful thing I've ever done is sing happy birthday to somebody, right? And like doing that, it brings chills to my body still, you know? So I think just exactly what Stacey's saying, just recognizing people and, you know, sharing the love that we all have within ourselves. You know, sometimes saying hey to somebody on the street might be little to you, but to that person, it means a lot. And I hear that a lot.
Right, so I just wanted to take this time to thank you all, Stacey, Rayce, Dinah, and Colin. My name is Anthony Torres. I was the moderator, and I want to thank the audience for this lovely conversation, and thank you and good night.